we do have an opportunity to have a few questions, and while you're getting those questions to Katie and the others in the room, I certainly want to acknowledge that there's things that we can do. As Dr. Dunham said, that in terms of local lobbying and working with your representatives so that you can create that bipartisan support in Congress for the kinds of things that need to be done. And then on the other level, with Minnesota, we don't have to reinvent the wheel all the time. There's templates out there. And Minnesota obviously has done a terrific job of that. So as you go back to your states, perhaps you can use Minnesota as a model, or at least a launching point for some of the discussions and initiatives that you might have on your local level. With that said, here are some questions. The first one, Dr. Beaudoin, on your program, to what level were producers involved in the strategic plan and as they look at practical implications of your strategic plan?
I can say that for the most part in the strategic planning, it was more producer groups who were involved. So Minnesota Milk, the Minnesota Beef, and Minnesota Pork Board. I think that as we move forward, and I think that, so I should also say the reason that I am now directing these activities is that my background is as a veterinarian. I've also worked for CDC. I also have experience in influenza research in swine and poultry settings, and so the reason I think that was hired to do this job is because I'm able to identify who might be pertinent and who needs to be brought in, and also talk to all of the sides. I think even now, I've been in this job just for 2 months now. Even now, I'm still identifying folks that we should bring into the fold. And so I do think that it was a starting point, and the primary starting point was to involve the producer groups and get the buy-in from them. And now, as we're moving forward, I think both producers and veterinarians who are practicing are going to be a key part of moving these activities forward.
On a similar note, Dr. Dunham, how can wildlife organizations and others, such as the pet fish community, be included in the animal and environmental section of these efforts?
Another great question, and they do need to be involved. In fact, they were one of the groups that really did a resounding job of showcasing how much does take place with wildlife and the environment on so many of these issues, and there's a couple of papers that they have put out that I think would be very helpful. It's again inviting them to the table and not forgetting. So this is again a really good point. I'm glad someone in the audience raised it. We do have to interact because we do have wildlife all around and we're moving into their area more and more. And certainly when it comes to disease transmission, no one's immune. So I think that's an excellent point, and I hope it showcases that you're thinking to engage everybody. So thank you for raising that question.
Okay, you bet. Dr. Beaudoin, can you tell us more about the CMS rules?
I might have one of our CDC colleagues answer this question so that I do it appropriately. But in general, the requirement will be that hospitals have antibiotic stewardship programs in place that are consistent with CDC 7 core elements of antibiotic stewardship. And there will be changes also to long-term care, which is nursing homes. And in that case, I don't know that they have to be particularly consistent with the 7 core elements, but have to have an antibiotic stewardship program and someone who has been identified as a leader for antibiotic stewardship for those facilities.
Okay. Before we get to the one last question that we have, I would ask that the next panel, if they could go to the back and get mic'd up, that would be wonderful. The question here is, how can we work with, to either one of you, how can we work with international groups in other countries which approach these issues so differently?
I guess I can start from maybe a brief comment. Prior to starting in this job, I was working for CDC in the international program, and we were focused on assisting governments to establish surveillance systems for antibiotic-resistant pathogens. And so the engagement, I can tell you, in the vast majority of countries in which CDC has been working under this global health security agenda for this goal, most of those governments are really enthusiastic about doing it. They want to understand how can we put systems in place where we can collect the data that we need to understand the risk to our population, and also to understand how things are changing over time. And so, in my experience, the response has been terrific, and I think that the communications and the relationships that agencies like CDC has with foreign governments to establish resistant surveillance systems is essential to not just helping those countries to identify what their concerns are, but to honestly keep us safe here in the U.S. and to know what those threats are.
I can only echo what you just heard. But it's just the fact that they want to get engaged and they're reaching out, and we need to be able to assist, we being any of the countries that have systems and programs, to be able to find out what are the gaps that they're facing and how can we assist. And I think part of that is to be the relationship building. It shouldn't be that we just stop by and say, what do you need? Oh, here you go, 1, 2, 3, and then walk away. We have done that too much, and we have to stop. I think we have to have consistency and be there, and if a country is taking some baby steps forward because of their finances or their capabilities, then where can we assist, and what would that look like? And to be able to showcase that and be there so that they can then get their feet in the ground and move forward. They come to the meetings. It's amazing, their dedication. They may only have 1 or 2, but they are really dedicated and they want to find ways to start. But you have a dedicated person like that from a country, and you have a gold mine to work with because they are so, as you said, passionate and want to do something. So once again, listening to see how we can help them is important, and other countries need to do the same thing. So this is your global interaction, and being able to say, let's start this and be flexible to change as they develop programs. And if it's going to be diagnostics and laboratory facilities, do they even have that? What's the capability to sustain a laboratory? Do they have reagents? What about equipment? We're so quick to drop off and say, I'm helping you. Here's a piece of equipment, but then we forget to sustain it, maintain it, and give you the reagents. So again, if we can get into some rapid diagnostic development, how will that be utilized in the countries? We've got to have the dialogue back and forth, but they absolutely want to be there working with us.